you survive this 5 minutes?
First exercise.
Start with your tummy on the ground with your legs flat on the ground. Then raise your upper body by pushing your upper body off the ground. One important point to note is do not lift your waist off the ground. Just lift to the level which allows your waist to be still in contact with the ground.
Ten seconds left. Next exercise.
Get on all fours in a comfortable position with your knees about your shoulder width apart. Then as you breathe in, suck in your tummy and arch your back upwards and look down as well. As you breathe out, arch in the other direction and look up. Repeat this movement slowly.
10 seconds left. Rest. Next exercise.
Lie flat on the ground with your knees bent and feet flat on the ground. While keeping your knees together, slowly move your knees to the side and then to the other side. One thing to note is that once you feel pain as you shift your knees to one side, stop and go the opposite direction. Do not move your knees past the pain position.
Seconds left. Next exercise. Halfway there.
Lie flat on the ground and gently pull one knee close to your chest. You can keep the other leg straightened or bent. This will help to stretch your hip flexors, which are tight and the reason for back pain. As you pull one knee towards your chest and the other leg gets pulled up too, it means that you have tight hip flexors, which is not unusual. You can do about 5 pulls in one leg and then switch to the other side for another 5 pulls. Remember to breathe consistently during the stretch.
Ten seconds left. Rest. Next exercise.
For this exercise, you want to raise your right leg up and you should feel your hamstrings, which is at the back of your thigh, getting stretched.
Seconds left. Last exercise.
Now we move on to the other side, which is also our last exercise. Remember to relax and breathe in as you feel your left hamstring being gently stretched.
10 seconds left. Workout complete. You have earned my respect. For now.